Hi, it's Dr. Centeno. I'd like to go over what is DMX and what do the results mean, especially if you have CCJ instability. So CCJ instability means that the upper neck bones move around too much due to lax ligaments. These can include the alar, transverse, accessory, apical ligaments, as well as others. And there are two types of imaging that can suggest CCJ instability. One is static, non-moving imaging. The other is dynamic or moving imaging. Obviously, since this is a dynamic problem, meaning it's unstable and things are moving, then moving imaging obviously probably has a role here. And one of those dynamic measurements that can be performed is called a DMX, and that stands for Digital Motion X-ray. So DMX works by having you move your neck and recording the motion of the vertebra. So it looks something like this. You see moving vertebra, you see the skull moving there. Now there's some limits for the amount of movement or the angles that have been established, but that's only one part of the puzzle in looking for CCJ instability and making that diagnosis. So you need to make sure that you understand, in addition, that the normals for DMX are not as well established as some of the other normals are for static measurements. But the two most common things we look at are C1, C2 overhang and the ADI, or the atlantodental interspace. If you look at my little illustration here, you can see that we've got the skull up here, and then we've got the C1 or atlas bone, and you're only seeing two parts of that here, and then the C2 bone. So the skull rests on C1, which rests on C2. And this measurement that we're going to look at, our C1, C2 overhang, measures the opposite alar ligament. So this alar ligament can get stretched when the vertebra wants to go that way. So C1, C2 overhang is nothing more than having the patient bend their neck and then looking at whether or not these guys line up, C1 and C2, or whether or not the C1 shifts that way relative to the C2. And if it's more than 2 millimeters or so, or about 2 millimeters, then this is considered to be due to laxity, again, the opposite alar ligament. And that's one of the things that would determine CCJ instability, again, as long as the rest of the clinical picture matches up. ADI stands for atlantodental interspace, and it's the distance between the dens of C2 and the front of the atlas when the patient is looking down. And this area is held together by the transverse ligament, so an increased or V-shaped ADI can mean ligament laxity. And that transverse ligament, and I'll show it to you here, acts like the seat belt for the dens. So it's right here. This is the dens, and we're looking down. And so the transverse ligament, again, acts as like a seat belt for the dens. And it can prevent all of this from moving forward as you look down. So a normal ADI is 1 to 3 millimeters in adults. And if it's more than that, there may be CCJ instability. Again, all of the parts of the picture have to add up, not just the imaging. So for more information, contact the CCJ Instability Institute at ccjinstability.com. Thanks so much for watching and have a great day.